A single episode of painful or burning urination, seemingly harmless, could be the first sign of a silent infection that's damaging your kidneys, risking your fertility, or even threatening your life. Worse yet, many people don't even know they're infected until it's too late, because early symptoms are often ignored or misjudged. Welcome to Health First 365, the podcast where science meets everyday health. Here, we don't scare you, we give you the truth, backed by leading medical experts. In this episode, you'll hear firsthand from a specialist in andrology who has treated thousands of urinary tract infections. He'll break down the real causes behind painful urination, how to run targeted diagnostic tests, apply the correct treatment protocol, and prevent relapse for good. If you've ever dismissed your symptoms or believed a few antibiotic pills would fix everything, this episode is a must-watch. Because just minutes from now, you'll learn why getting it wrong could cost you your fertility, or worse. So why are urinary tract infections becoming more common than ever? And what's behind the alarming rise in cases among younger men, even those as young as 15? The answer lies in silent changes in lifestyle and sexual behavior. In the past, UTIs in men were most often seen from age 18 and above, typically around the onset of sexual activity. The causes were usually poor hygiene, unprotected sex, improper treatment, or anatomical abnormalities such as long, tight, or hardened foreskin, or a narrowed urethral opening, all of which create stagnant urine and invite bacterial growth. But now, doctors are seeing UTI cases in much younger males, some as young as 15. These teens are entering puberty, exploring sexuality, but without the guidance or knowledge to properly care for their bodies. They may engage in self-stimulation or first-time sex, without cleaning their hands or genitals afterward, silently setting the stage for infection. At the other end of the spectrum, older men aren't exempt. Those with prostate issues, like enlargement or inflammation, often experience urinary blockage. This backflow and retention lead to recurring infections, often undetected until complications occur. All of this adds up to one uncomfortable truth: UTIs in men are no longer age-specific. Whether you're a teenager or a full-grown adult, you're at risk, unless you understand your body and learn how to protect it. So what truly makes urinary tract infections in men so persistent, so widespread, and so dangerous? First, let's be clear. This isn't a condition that appears out of nowhere. In most cases, UTIs stem from a series of everyday actions that men often overlook, yet they open the floodgates for bacteria to invade. One of the most common culprits is unprotected sex. Not using condoms, having multiple partners, or skipping hygiene before and after intercourse allows external bacteria to enter the urinary tract. And the scary part? These bacteria don't always come from others. Sometimes, they come from our own bodies. From our hands, surfaces, or even bacteria near the anus migrating to the genital area due to poor hygiene. Then there's post-masturbation hygiene, rarely discussed but absolutely critical. Many young men masturbate without washing their hands or cleaning their genitals afterward. This creates an ideal environment for bacteria to grow and linger. Another major factor that often goes unnoticed is anatomical abnormalities. A long, tight, or hardened foreskin can trap urine, allowing bacteria to flourish. A narrow urethral opening weakens urine flow, making it harder for the body to flush out bacteria, leading to chronic infections. And finally, there's the all-too-common mistake: improper treatment. Taking leftover antibiotics, stopping medication early, or never getting tested for the actual cause means the bacteria are never fully eliminated. The infection keeps coming back, and worse, it breeds antibiotic-resistant strains that become harder and harder to treat. But if you think a urinary tract infection is just a temporary discomfort that will go away on its own, the truth might shock you, and it should. Because when not treated properly, the bacteria don't simply disappear. They hide. They adapt. And they begin a quiet, destructive takeover from within. First comes antibiotic resistance. When you take the wrong antibiotic or stop too early, the bacteria survive. They get stronger. And the next time they return, your medications might no longer work. Then there's the prostate, a critical gland in male reproduction. If bacteria reach it, they can cause inflammation, which may turn into an abscess. In severe cases, This can lead to bloodstream infections, organ failure, even death. But it doesn't stop there. The infection can travel to the vas deferens, the tubes that carry sperm. Once inflamed and blocked, the result is often irreversible: male infertility. In more advanced cases, bacteria spread to the testicles and epididymis, forming painful abscesses. If left untreated, surgical removal of the testicle may become necessary, leading to hormonal disruption and permanent loss of fertility. And worst of all, your partner may also be at risk. Having sex while infected can transmit the bacteria, leading to vaginal infections, cervical inflammation, pelvic inflammatory disease, blocked fallopian tubes, and, ultimately, female infertility. The worst outcomes are entirely preventable, but only if treatment is done properly, completely, and without delay. Given all the severe consequences, the real question is, how can you detect this condition early, before it begins to damage your body? Fortunately, urinary tract infections aren't invisible enemies. They send warning signs. You just need to pay attention to what your body is telling you. The very first sign is often subtle, yet impossible to ignore: a burning, stinging, or painful sensation while urinating. This isn't the discomfort of holding it too long or being dehydrated. It's persistent, and it happens even when your bladder isn't full. Next is the smell of your urine, something people rarely notice, but it's a powerful indicator. If your urine has a strong, foul, or unusual odor, or appears cloudy or darker than normal, your body may be fighting off a bacterial invasion. You might also notice changes in urine clarity, a sticky texture, or the feeling that your bladder isn't fully empty, even after urinating. When left untreated, things escalate. A white or yellowish discharge may begin seeping from the urethra, especially in the early morning or repeatedly throughout the day. At this point, it's no longer just a symptom. It's a red flag. Bacteria have invaded and are actively damaging your urinary tract. Early detection is your window to full recovery, before it spreads, affects your fertility or hormones, or is transmitted to your partner. And above all, never ignore the quiet signals your body is sending. Once your body starts signaling trouble, your next move isn't to guess, it's to get the facts through proper testing. And this is non-negotiable. Never self-treat without knowing exactly what you're up against. In urinary tract infections, identifying the root cause is critical for complete recovery. The first step is a routine urinalysis, a simple but powerful test that checks for inflammation markers like white blood cells, red blood cells, bacteria, or abnormal proteins in your urine. Next, your urine sample should be sent for culture. This determines the exact type of bacteria causing the infection. Each species responds to different antibiotics. If you take the wrong medication, not only will the infection persist, but the bacteria may become resistant, a much bigger problem down the line. But here's what most people don't realize: UTIs are often caused by more than one type of microbe. A study involving over 13,000 male patients found that 36% were infected by multiple pathogens simultaneously, including bacteria, viruses, fungi, and even parasites. That's why beyond traditional testing, modern medicine now recommends molecular diagnostics like PCR or NAAT. These high-precision tests can detect co-infections and deliver detailed results within hours. In our podcast, the doctor jokingly referred to them as ride-hailing tests, because they're fast, reliable, and straight to the point. Once doctors have a complete picture, they can prescribe a targeted treatment plan, one that eliminates the real cause, not just the symptoms. And that is the only way to break the cycle of recurrence. Once the cause of infection is clearly identified, the most crucial part of treatment is this: don't play guessing games with your health. In the past, many people made the mistake of using what doctors call shotgun antibiotics, picking a strong, broad-spectrum drug and hoping it hits the target. But that only weakens your immune system, strengthens the bacteria, and slowly renders antibiotics useless. Modern medicine takes a different approach: targeted therapy. If the culprit is bacteria, use specific antibiotics. If it's fungal, antifungal drugs are needed. In cases of co-infection with bacteria, viruses, or parasites, a tailored combination therapy is used to strike each microbe at its weakest point. The good news? When the right medication is used, Most patients begin to improve within 7 days, often seeing 70 to 80% of their symptoms relieved. But here's the catch, and it's a big one. Many men stop taking their medication around day 4 or 5, thinking they're cured. But the bacteria are not completely gone. They hide, waiting to strike again, stronger, more stubborn, and possibly forming abscesses or chronic inflammation. That's why the recommended treatment duration is 7 to 14 days, depending on the type and severity of the infection. Just as important is retesting after the treatment ends, to ensure the infection is truly gone. Targeted treatment doesn't just bring faster relief, it protects your fertility, your health, and your future. You followed the treatment, took the right medication, yet just weeks later, the burning and stinging return as if they never left. What went wrong? The truth is, urinary tract infections often recur not because the medicine failed, but because the treatment was incomplete and the same bad habits continued. The most common issue is early termination. Many people stop taking antibiotics as soon as symptoms improve, unaware that the bacteria are still hiding, waiting to strike again once immunity drops. Another overlooked factor is the presence of anatomical abnormalities, such as a tight or long foreskin, or a narrowed urethral opening. If these aren't corrected, infections will likely keep returning, no matter how effective the medication was. Then there's the matter of unsafe sex during treatment. Continuing sexual activity without condoms, especially when your partner isn't treated simultaneously, simply reintroduces the bacteria you're trying to eliminate. Personal hygiene also plays a quiet but critical role. Inconsistent or improper cleaning practices create the perfect breeding ground for bacteria to return. And perhaps the most underestimated cause, ignoring the fact that many UTIs involve multiple pathogens. A single infection may include bacteria, viruses, fungi, or parasites. If only one is treated, the others survive, and they'll bring the infection back. Relapse isn't bad luck. It's the result of an incomplete battle plan. Only by addressing the full picture can you break the cycle for good. To treat a urinary tract infection effectively, and keep it from coming back, medication alone isn't enough. You need a comprehensive strategy, strict adherence to guidelines, and no skipped steps. First, start smart. See a doctor and get tested properly. Don't rely on self-diagnosis or random recommendations from friends. A full urinalysis, urine sediment test, culture, and if needed, advanced tests like PCR or NAAT, will tell your doctor exactly what kind of bacteria, virus, or fungus is involved. Only then can a targeted treatment plan be designed to truly eliminate the infection. Next, treatment must be both accurate and complete. Even if you feel better after a few days, never stop the medication early. A follow-up test after the treatment is essential to confirm that the infection is completely gone, not just temporarily silenced. Another key point is sexual activity during treatment. Ideally, abstain until fully recovered. If you do engage in sex, use condoms properly to avoid reintroducing or spreading the infection. Also, don't underestimate hygiene. You don't need expensive or harsh cleansing products. Clean water and mild body soap, used daily, are enough to keep the genital area fresh and prevent bacterial buildup. And perhaps the most forgotten yet critical step, your partner must be treated too. If only one of you is medicated, you might recover, only to get reinfected the next time you're intimate. Simultaneous treatment is the only way to break the cycle once and for all. Once you've successfully overcome a urinary tract infection, it's not time to relax just yet. The real challenge lies in making sure it never comes back. Prevention is always better than cure, especially with conditions like UTIs that have a high risk of recurrence. And here's the good news: prevention is completely within your control. Start with your sex life. Safe sexual practices are essential. Staying faithful to one partner isn't just a moral principle, it's a health strategy. If you're with someone whose health status is uncertain, always use condoms correctly. It's not just about preventing STDs, it's also about protecting your urinary tract from bacteria. Next, let's talk hygiene. It sounds basic, but many people overlook it. Washing the genital area daily with clean water and mild soap is the simplest way to prevent bacterial buildup. especially after sex or using the restroom. Never delay cleaning your body. Another key factor that's often ignored is anatomical abnormalities. A tight or elongated foreskin, or a narrow urethral opening, can become breeding grounds for bacteria. If you suspect any of these issues, consult a doctor for proper assessment and early intervention. And finally, if you've been through an infection once, you already know the importance of completing your treatment and returning for follow-up tests. That's not just for your own safety, it's how you protect your partner from the cycle of reinfection. Dear listener, a urinary tract infection is not just a fleeting discomfort. It's your body sounding the alarm, telling you it's time to listen, to take charge, and to treat your health with the seriousness it deserves. We hope that by now, you've gained a clearer and more practical understanding of what seems like a minor issue, but can have far-reaching consequences. This condition doesn't affect just you. It can affect the person you love. And most importantly, no one is immune, whether it's a teenager's first sexual experience or a married man of many years. Among everything we've discussed, one message stands out. Men play a central role in preventing the spread and recurrence of urinary tract infections. When a man is informed, gets tested, follows treatment protocols, practices good hygiene, and engages in safe sex, he's not only protecting himself, he's protecting his partner. Awareness is where change begins. And the most meaningful action you can take today is to tune into your body, never ignore warning signs, and seek professional help when needed. Treating the infection properly doesn't just cure the illness, it frees you from the fear of silent relapse. If you found value in today's episode, please share it with your family, friends, and especially those at risk who may never have heard the words UTI in men. Your share could protect someone's health, or even their ability to have children. And don't forget, Health First 365 is just getting started. We have a full library of expert-led podcast episodes on men's health, sexual wellness, nutrition, and the latest trending topics in medical science. Visit the channel and explore more content that empowers you to take full control of your health journey. Thank you for staying with us until the very end. We believe that the right knowledge today leads to the right choices tomorrow. Subscribe to the channel, hit the notification bell, and never miss another powerful episode from Health First 365. We'll see you in the next podcast, where your health always comes first.